Just woke up this morning. My guess is he sneezed 20 times consecutively. If you're having trouble breathing these days, you likely have complications from what's going around in the tri-state.
And I still sound like I am a little bit, too. Medical reporter Liz Bonis joins us now with advice from the experts on finding relief. Liz?
Hitting a little close to home here. Good afternoon, guys. If you're feeling congestion, wheezing, upper respiratory effects, you're likely requesting some of these in the doctor's office. You're not alone this week. One of the chief complaints in doctor's offices, also a great question a viewer asked us to ask our TriHealth experts about. How do you find relief from asthma complications? This time of year, the shift in seasons might be making it hard for you to breathe.
I think patients are having to deal with abrupt weather changes, the pressure changes, and the pollens.
Dr. Jeff Raub says the late flu season increased respiratory infections for a lot of people, adding to the risk for complications from asthma.
We think that, any type of viral infection you can get can lead to your nose and your sinuses being congested, and then when that happens, any asthmatic will always have symptoms in their chest. Wheezing, coughing, shortness of breath.
As he showed us in this demonstration, the only way to keep those symptoms from getting worse is to get ahead of them, not chase them once they feel out of control.
The better way to do that is for us to find a way to convince people who have asthma to be consistent, to make the use of your controller medicines a habit.
In addition to that, however, he suggests you ask your doctor about something called a peak flow meter. It looks like this. You can get a prescription for it. And what it will tell you is whether or not your breathing is getting diminished, even if you feel fine. Together, then, you can develop an action plan that could make a difference for keeping you out of the emergency room. That action plan can give you specific instructions to maintain open airways, which hopefully means rather than this time of year continuing to make it hard for you to breathe, you can step outside, stay active, and breathe a sigh of relief. There are newer prescriptions and inhalers now that can help keep your airways open, but if you have not seen a specialist for your asthma in a while, you may not be getting these as you need them. We do have a link to allergy and asthma specialists at TriHealth at local12.com, or if you have a question for a provider, you can simply go there and click on Ask the Expert. I'm glad, as I say, that you two are feeling this. Once that gets into the chest, like you got it, it might be a complication from something else, but right now it can be from allergies, it can be from a respiratory virus, and it's still not going to maybe go away without you getting some treatment. So a couple more days.
We've got all of that stuff.
I bet you do.
I am feeling better.
I'm glad.